You're listening to Certify It, the podcast for advancing your career in care, powered by the Mason Center for Healthcare Education. Hear news, updates, and discussions from thought leaders in healthcare around advancing your career through continuing education.
Welcome to Certify It. Today we have one of my favorite people in the entire world, actually. This is Kim Mountz. She is the Vice President of Clinical Services for Hillcrest Healthcare. And we're going to be talking today about the Medication Aide program that we offer here at the Mason Center for Healthcare Education. And who better to talk about that than not only someone who has real life experience inside the senior living communities that we're all a part of. And fun fact that she just reminded me of, she actually is the co-author of the program that we have here at the Mason Center. She was extremely instrumental in us being able to get this passed through the state and the Board of Nursing. So Kim, welcome. We're glad you're here. So why don't you talk a little bit about how you got into healthcare in your career that you've had in care?
I got a little later start. I didn't go straight out of high school and go to college the traditional way, but my mom is the one that got me into it. She said, my mom worked in a factory for 40 years, and she said, you need to do something that you can take care of yourself. So nursing, she said, go into nursing. So that's what I did.
And then now your mom didn't stay at the factory.
Nope. After 40 years, she went to a long-term care facility in our community and worked as they called them room aide or hydration aide, and she passed ice and answered the phone or non-clinical things she did.
Well, that's interesting. So your mom never really benefited from the healthcare education that is out there today, but she wanted you to be able to do that.
She did, and she was so proud that I made it through, yes.
You're a registered nurse.
Yes.
So how long have you been in long-term care?
I started in long-term care. When I graduated, I went back then. In those days, you had to go to the hospital, and you had to go on night shift, and it was a lengthy process. So a friend of mine worked at the long-term care facility, and they said, come on over. So I went over, and that's where I started. I started out as a floor nurse, then a charge nurse, then a unit manager. So I went all the way up. But when you're in long-term care, I know people talk and they say you cannot do anything but long-term care. Long-term care nurses can't do anything but long-term care, but that's not true. But I let the talk get to me, and I went to the hospital, and I could do just as much as they could do in ICU. I did different things in the hospital, worked on the floor, short stay ICU, and wherever they pulled us. But even when I was in ICU, I was drawn toward the elderly, and nobody else wanted to take care of those people. They wanted the young heart patients, so I always took care of those. So I always went back to long-term care, and that's just what I love.
I had a mentor one time tell me that once you've worked in long-term care, it gets in your blood and it can't come out.
Absolutely, it does.
And I found that to be true. My story was more, if you had told me in high school that I'd be working in long-term care as a profession or a career, I would have said, you are absolutely crazy. What in the world would I do in a nursing home with all the stigma that comes with that,
yes.
Unfortunately. But it does. It gets in there, and people that work long-term care love long-term care.
Absolutely.
And they stick with it. We're a very small community of people. So you did help us get the Medication Aide.
Yes.
What was it that excited you so much about Medication Aides finally being able to be used in Tennessee?
It was new, and it was exciting for me because in long-term care, a big portion of your day is passing medication. So to be able to take that off of a nurse and let her do other things, it was just exciting to me. And I think they're, like you said, they're underutilized. And we were kind of the pioneers of that. So I feel strongly that we could utilize them a lot more.
So what do you think is the hesitation that it seems to be in our industry of utilizing them?
I think that the DONs and the nurses think if we get medication aides, they're not going to have a job. And that's not true at all. That's not the job for the medication aide.
That was one question that they asked, I know, when you and Brandy went to Nashville to get the program approved was, are you doing this to try to replace nurses? And your all's answer was what?
Absolutely not. They're an extension of the nurse. So yes, that was a question.
Much like the nurse practitioner is an extension of the physician.
Absolutely.
We've not gotten rid of physicians, and nurse practitioners have been around a long time.
Absolutely.
One thing that I've always found intriguing about medication aides too is that they have to be CNAs, so they have to already be certified nursing assistants with the state.
Yes.
The criteria that the state puts in place is they also have to be stable CNAs in their work history. They can't have had more than 2 jobs in the past 12 months.
Mm-hmm, that's correct.
Which also means the person, if we can get CNAs to skill up into medication aides, then the people that know our people that we're serving on a daily basis the most, that get to spend the most time with them, that are doing the personal care and really building those relationships with them, becomes the person that's passing their medications.
Yes.
How important is that the person passing the meds is someone that really knows the resident?
It's extremely important. It's the trust that they build with the residents. And if you don't trust someone, chances are you're not going to take medicines, or you'll question, and they won't do that with a CNA and someone they know.
You're listening to Certify It, the podcast for advancing your career in care. Brought to you by Propel Insurance. Find innovative insurance solutions in the toughest risk management environments. Over 500 senior care providers nationwide trust Propel to keep their business thriving. Find your momentum with Propel Insurance.
It would be really interesting for somebody to do a study, and maybe you can do one in Hillcrest when we get medications aides up and fully operational in our facilities. But it would be interesting to know if there's a higher rate of success at giving medications and less refusals when it is that person that trusts them so much to be able to add data to the positive outcomes that even we've seen. We do have a building that utilizes medication aides. Yes. So how have you seen it work there when you've seen it in action? Because you've been on the floor doing audits and... They're
very focused. I won't say more than a nurse, but they're very focused. They take their job very, very seriously. And the residents love them because they know them.
So if there was a CNA out there that was thinking about becoming upskilled as a medication aide, or they're trying to decide between medication aide and possibly LPN or going on to nursing school, what would your advice to them be?
My advice would be take the medication aide class. That way you can dip your toe in the water. And if you absolutely just, this is not for me, then you would know that. So I think that would be my advice to someone, because it is such a large part of the job. Even when you go to LPN school and you become an LPN or an RN, when you're on the floor, you're passing medications. So,
and we've seen the criteria that is required and the education that's required to be a medication aide. I can only imagine that with the amount of material that they cover in that 3-week class and then the 1-week clinical, it would be very easy to then transition to a nursing program, because you're going to already have almost a fast track start on a lot of that information. So tell us a little bit about what's covered in that medication aide training.
I guess the easiest way to say it is the why. It's the how you give the medication, but it's also the why you give the medication. They have to take pharmacology in that. So it's not just I'll take this easy class. It's a hard class, but it's well worth it when you get out of it. And to go from that, let's say you wanted to go to LPN school, you'll know a great deal when you get in there, because going straight off the street, I had never done that. And a lot of the questions are medication questions, and I didn't know them, so you have to learn. So there's a great advantage to being a med tech.
We had one of our students before the class had just finished, and they had come back in to do some of their skills, getting ready to do their testing. And she said, I did not know I was taking anatomy and physiology and pharmacology in 3 weeks.
Yes.
Because it's every body system.
Yes, it is.
It's pharmacology. And it's not a one and done either.
No.
Like once you've gotten certified, you also have to have a continuing education, and 8 hours of that continuing education is pharmacology, which we just so happen to offer here at
yes.
The Mason Center for Healthcare Education. So that is something else that if you're already a certified medication aide in Tennessee and are looking for somewhere to do your continuing education, those classes are hard to find. And that continuing education is hard to find. And that is something that we do provide here. But that also keeps their skills very fresh.
Yes.
And even in pharmacology is not something that nurses have to have continuing education on.
I think it's a wonderful program. And I think if anybody's thinking about furthering their career, please apply and come to the class.
Well, thank you so much for being with us today. This has been Certify It, the podcast for advancing your career in care.
We hope you enjoyed this episode of Certify It by the Mason Center for Healthcare Education. Get connected with us on social media and at themasoncenternknox.com. If you haven't yet, subscribe to this podcast on YouTube and anywhere you get your podcasts. And if you're interested in sponsorship or donations to help further our cause of providing affordable, flexible healthcare certification programs for individuals seeking career mobility in skilled nursing, senior living, and long-term care fields, visit themasoncenternknox.com.